A report by Kaiser Health News and the Guardian sheds light on just how many healthcare workers have died during this pandemic, and why so many of them have died during this pandemic. About 3,000 COVID-related deaths among healthcare workers in the United States have occurred since the beginning of the coronavirus pandemic. And so this 9-month investigation by over 70 reporters found these horrific details. One of the many reasons is dire PPE shortages, limited COVID tests, sparse tracking of viral spread, layers of flawed policies handed down by healthcare executives and politicians, and lax enforcement by government regulators have contributed to the deaths of more than 2,900 healthcare workers. This number is actually far higher than that reported by the US government, which does not have a comprehensive national count. So we had to rely on journalists to investigate this to give us a more accurate number. And there's a lot of inequality among healthcare workers as well. It really depends on how well these hospitals are funded. Workers at well-funded academic medical centers, hubs of policymaking, clout and prestigious research, for instance, were largely spared. Those who died tended to work in less prestigious community hospitals, nursing homes, and other health centers in roles where access to critical information was low and patient contact was high. So John, I mean, I always appreciate your reporting on COVID because you do a really good job in keeping track of the numbers and reminding your audience on a regular basis of how serious this is, how we shouldn't lose focus on how serious this is. And so, yeah, I wanted to get your thoughts on, this new reporting.
Yeah, it's devastating. Like any way that you slice up the numbers is gonna be terrible. But like if you picture, yesterday's death count, which just got updated. So that was 3,379 deaths reported in one day. If you picture all of those people clustered in one group, it is like so horrifying that we've become, I guess, even us who care about this, let alone the ones who don't, been inoculated against the horror of it. But you should be horrified. But when you imagine a crowd that size of just the doctors and nurses, like the frontline healthcare workers that we sort of imply popularly that we really respect and care about. And I'm sure many individual people who aren't in a position of power actually feel that, but those who were in a position to save more of those lives chose not to. They might have tweeted about how nurses are great or whatever, but they didn't actually care to save their lives. Don't think that that's horrifying. The idea that you could have thousands, we shouldn't have lost thousands no matter what, let alone tens of thousands. The idea that you could do so in one industry, basically, that you could have that number of doctors, or you could have that number of people who work in food processing plants or something like that. I mean, God only knows the number of people who had to continue working in food service, groceries, those sorts of things during this time. It's just horrendous. Every story like this is a reminder of how unnecessary and needless it is. And when you mash it up against, and I'll only mention this because I don't think that we're playing the video, all the videos that are now being shared on Twitter of like the Republican year-end Christmas parties, like Matt Gaetz doing karaoke after, like on day one wearing a gas mask because he thought the hysteria around COVID was so hilarious, or the Republican group in New York of them doing a conga line because we nailed it and it was a great year and we're still alive. Hundreds of thousands of people have died, but it was a fun year for us. We're gonna have fun and dance and stuff. The whole thing's just disgusting, and I really just hope that for the rest of our life we never forget this experience. I doubt we'll be able to.
I know. I mean, I can't imagine being able to forget this. I mean, it's yeah. I mean, you look at the numbers, you look at the pain and suffering, both the loss of human life, the economic disaster for so many Americans who have survived this pandemic, and just like the lack of real relief from our lawmakers. Like the whole thing is just one giant fail after the next. And look, one of the biggest issues here in regard to healthcare workers is the lack of PPE. And so you could have a broader discussion, and I think it's an important discussion to have regarding our supply chain and how we need to be manufacturing these products here in the United States. So we actually are prepared. We're prepared for something like this, and we don't have to rely on other countries who provide these products, personal protective equipment. But remember, in the beginning of the pandemic, on February 7th, Secretary of State Mike Pompeo bragged openly on Twitter, and this tweet is still up, about sending PPE to Wuhan, China. So here's Secretary Pompeo writing on February 7th, we have coordinated with US organizations to transport more humanitarian relief to people in Wuhan. Personal protective equipment and other medical supplies donated by these organizations can help save lives in China and help protect people from the coronavirus. Yeah, I mean, our own healthcare workers desperately needed that as well. And it was just one bungle after the next. Sorry to use a funny sounding word in such a serious story, but you get the picture. Just lack of preparedness, lack of, by the way, the unwillingness to tap into private companies to produce the products that we needed, the personal protective equipment that healthcare workers needed in the beginning of the pandemic. Trump refused to do that. And then I want to give you a few more details from this Guardian report. Complaints to state worker safety officials filed in March and April said the Garfield Medical Center workers were asked to reuse the same N95 respirator mask for a week. Another complaint said workers ran out of medical gowns and were directed to use less protective gowns typically provided to patients. I mean, the list goes on, and it's because A, we weren't prepared. Obviously, we have no leadership in the executive branch. We have a president who admitted to downplaying the severity of the virus in the beginning and also throughout the pandemic. We have an issue where I think we're uniquely poorly positioned because we've decided to commodify our healthcare industry as much as humanly possible. And so we don't have enough hospital beds because guess what? It doesn't make financial sense to have empty hospital beds. So we're not prepared for a pandemic. Like just fail after fail after fail. And my question is, and my last question on this story is, will the country actually learn something from this? Or will we continue to make the same mistakes and continue to be poorly prepared for a pandemic or other disasters moving forward? And I mean, obviously I'm a pessimistic person. You probably know how I feel, but John, I don't know, you seem to be more optimistic than me. Do you think that we'll learn something from this? Right.
I think you and I have learned some things from this. Will a country learn? The country's incapable of learning. It's too stratified. I mean, the anti-maskers have learned how to weaponize selfishness as a tool to effectively get away with murder. I don't know. Maybe people not in charge will learn something. You know, this has been a massive experiment for, like an experiment by that I mean an experience you go through and hopefully learn from for healthcare workers, the CDC, which has never had to deal with this sort of thing, like in the last century at least here in the US. I'm sure they will learn things from this, but it is still like if COVID-21 happens or whatever, it's still gonna come down to who is in charge, who's actually coordinating it. Does anyone believe that if Donald Trump had won re-election, he would have suddenly taken the pandemic more seriously after he locked up a second term? Or that if a second one hit, after the experience of getting reelected after not caring about the first, that he would have cared more? I don't. I think it still very much comes down to who you have. Like, I know some people I've seen like on Twitter saying that like it wouldn't have mattered if Hillary had been in, the pandemic would have just been as bad. And I think that that's sheer madness. I think she would have been just as unlikely to fundamentally remake our healthcare industry. I agree about that. But in terms of the actual response to the pandemic, I think that that's insane. And so have this in the back of your mind for the rest of your life when choosing a president, choosing who to support and all that. This is another thing you need to worry about. These are not abstract threats, and the threats are not all overseas. It can happen here, it already has happened here.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR, so those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.